Welcome for the third case of the liver pathology slide review. Remember that you can have access to the whole slide images on Crosscope. So this is a biopsy that was performed in a 57-year-old patient. He has a known history of alcohol abuse with up to 8 or 10 drinks per day, and he's suspected to be a cirrhotic. He has asthenia, ascites, and there is a clinical suspicion of acute alcoholic hepatitis, and he has also, you can see the biological scores that are worrisome of hepatic dysfunction. We will now go to the slide. So let's have a look at the biopsy specimen. We will just have a quick look at low magnification. So you have here fibrous tract, and here some hepatocytic nodules. Here also you can see that there seem to be a massive steatosis, macrovascular steatosis. Here also some fibrous tracts. Again, hepatocytic nodule. Here also. So we have a parenchyma with destruction of the architecture, because we have these fibrous tracts that surround hepatocytic nodules. So we have a case of cirrhosis, and we will now go deeper into the slide. And what you can see in the fibrous tracts, you have some ductular reaction, also a mild inflammatory infiltrate. And what we see also is that within the hepatocellular nodules, we have inflammatory infiltrates with neutrophils. It's a polymorphonuclear infiltrate. And we may see here also some Mallory dank bodies. We have this macrovascular steatosis, and the appearance is more or less the same. Here also nice picture with all these inflammatory infiltrate that surround these hepatocytes. They are probably killing the hepatocytes. Here, an hepatocyte with probably a big Mallory bodies, this pink body. And this is the appearance throughout the whole biopsy. So if we try to summarize, we have a liver with the destruction of its architecture. We have fibrous tracts, and we have nodules with steatosis, with some also ballooning of hepatocytes, just like this one, with Mallory dank bodies. Also here, very nice one. This enlarged hepatocyte ballooning, it is clarified, the cytoplasm appear white, and you can see here this really nice Mallory dank body, and you have this necroinflammatory activity with this mixed inflammatory infiltrate. So we have all the components of lesion that are induced by alcohol. So my conclusion would be in this case that we have a chronic hepatitis at the cirrhotic stage, and the activity is probably moderate, the necroinflammatory activity moderate. It's heterogeneous, so sometimes it may seem more intense. And all these histological features, the steatosis, the ballooning, the clarification, the Mallory dank bodies, they are consistent with alcohol intake. So this histological appearance is consistent with an acute alcoholic steatohepatitis. So this was a really typical case, a really nice case. So acute alcoholic hepatitis is really aggressive disease, and there is no clear histological score that we may use to predict the prognosis, even as there have been some papers that reported that, for example, cholestasis was indicative of a worse prognosis. But this biopsy, they are performed in order to rule out another etiology before the beginning of corticoid therapy. So here are the take-home messages. So liver biopsy is performed when treatment is considered in the patient, or for the patient in whom there is a reasonable uncertainty regarding the underlying etiology, the underlying diagnosis. So the typical features of alcoholic steatohepatitis will be polymorphonuclear infiltrate, ballooning clarification, myeloid bodies, and steatosis. But remember that sometimes not all histological features are present on the biopsy.